Well, I think you first have to understand what those safety and security needs are, and that they differ from setting to setting. And a lot of mistakes that other companies make is thinking that a hospital is a hospital or healthcare is healthcare, and really it's not. The security needs can differ even within a given site or a given hospital, never mind between the various sectors. Again, residential care, community-based services and so on have very different security needs and very different risks. And so for us in Paladin, having been in healthcare for 25 years now, providing service to 160 facilities from coast to coast, we understand the differences, we understand those nuances, and we're able to develop solutions unique to a particular setting. And again, that's a distinction for us, because healthcare is unlike any other environment. It's delicate, it's fragile, yet it's dynamic and ever-changing. And so for us, we have to understand what the staff needs are. Right? We have to focus on the patient at the center of everything that we do. If we build all of our programs around patients, what's called patient-centered service, we're never going to go wrong. We've had a lot of experience helping clients with larger challenges beyond the day-to-day. Fiscal challenges, for example. There's a lot of pressure on healthcare organizations here in Ontario, in particular right now, to ensure that precious healthcare funding is diverted to patient care. So one of our successes has been looking at solutions for clients across the country to be able to deliver security services, to meet benchmarking and best practice standards, and at the same time to do so in a cost-effective manner. We have one client who regularly uses the term, "give me value for money." And we get that, we understand that, because any dollar that's not directed at patient care needs to be justified, so we want to focus on that. Some of the other ways that we help our clients is through revenue generation, through parking, for example. Having the expertise within our company to be able to look at parking revenues, to be able to look at how parking operations are managed, and help them make adjustments to ensure that they maximize revenues and reduced expenses, so that again, precious dollars can be put back into patient care and deliver those services for clients. The other way we do though on a day-to-day basis is just by demonstrating the kind of competence in a patient-centered environment that other companies can't. And we do it because of the way that we train our staff with as much as 160 hours of healthcare training before someone even gets oriented to a site. Then developing a pre-orientation so that our security officers can understand what kind of site is it they're going to. Is it a big, busy, dynamic trauma center? Is it a smaller communities healthcare center where they need different skills? What's that organization about? What's their culture? What's their values? Connecting with that before we put them onto the site for their orientation. So they receive extensive training, they receive pre-orientation, then they go to the site and apply that and learn about the site. So that when they're engaged with patient care staff in helping to safely manage a client or safely manage a patient, they're able to function without specific direction, and they're able to make good judgments. Because healthcare staff want to focus on delivering care to patients, and they don't have time really to take the time and guide the security folks step by step through what they should be doing in a given process. So the better trained, the more effective, the more professional the security staff are in a healthcare environment, the less time the clinical staff need to focus on helping them do their job.